a quorum with council members Benton, Bradford, Evans, Gadd, Gregg, and Nash present. Let's see, we didn't have anybody sign up for public comment today. I have a proposed consent agenda. Going to go through that by reading the numbers just really quick. There are some items that are pulled off. So if any of these items need to be pulled off, please just let me know. So item 1, 2, 3, 4, 5, 6, 7, 8, 10, 11, and 14. Oh, I apologize. Actually, yes, that's an oversight on my end. 1 and 2 will not be on consent. All right. Any of those items need to come off? All right. I will start reading with item number 3, RS 2025-1631. Sponsors Toombs, Huffman, Allen, and Gadd, a resolution appropriating a total of $221,000 from a certain account of the Community Safety Fund for grants to various nonprofit organizations for community safety programs. Item number 4, RS 2025-1632, sponsors Toombs, Huffman, Allen, and Gadd, a resolution appropriating a total of $563,908 from the Metropolitan Government acting by and through the Metropolitan Board of Health to Meharry Medical College and approving a grant contract by and between the Metropolitan Department Government acting by and through the Metropolitan Board of Health and Meharry Medical College for the provision of food assistance, medical case management, mental health services, outpatient services, psychosocial services, and outreach services for participants in the Ryan White Part A program. Item number 5, RS 2025-1633, sponsors Toombs, Huffman, Bradford, Gadd, and Hill, a resolution appropriating a total of $19,200 from the Metropolitan Government, acting by and through the Metropolitan Board of Health to the Music City Prep Clinic, and approving a grant contract by and between the Metropolitan Government acting by and through the Metropolitan Board of Health and Music City Prep Clinic for the provision of outreach services, early intervention services, medical case management, non-medical case management, emergency financial assistance, medical transportation, food bank, housing services, and referral services for participants in the Ryan White Part A program. Item number 6, RS 2025-1634, sponsors Toombs, Huffman, Allen, Gadd, and Hill, a resolution appropriating a total of $202, that is, from the Metropolitan Government, acting by and through the Metropolitan Board of Health to We Are One Recovery and approving a grant contract by and between the Metropolitan Government, acting by and through the Metropolitan Board of Health and We Are One Recovery for the provision of early intervention services, housing services, mental health services, psychosocial services, and transportation services for participants in the Ryan White Part A program. Item number 7, RS 2025-1635, sponsors Toombs, Huffman, Bradford, and Gadd, a resolution approving amendments 2 and 3 to a grant from the U.S. Department of Health and Human Services to the Metropolitan Government acting by and through the Metropolitan Board of Health to provide for the prevention, surveillance, diagnosis, and treatment of HIV/AIDS and to administer a minority AIDS initiative program. Item number 8, RS 2025-1636, sponsors Toombs, Huffman, Gadd, and Stiles, a resolution approving Amendment 1 to a particulate matter PM 2.5 ambient monitoring network grant from the U.S. Environmental Protection Agency to the Metropolitan Government acting by and through the Metropolitan Board of Health to assist with the necessary development, establishment, and maintenance of adequate monitoring programs for the prevention and control of air pollution in Nashville, Tennessee. Item number 10, RS 2025-1642, sponsors Toombs, Huffman, Gadd, Hill, and Stiles, a resolution approving an application for a Violent Crime Intervention Fund, VCIF, grant from the Tennessee Department of Finance and Administration Office of Criminal Justice Programs to the Metropolitan Government acting by and through the Metropolitan Nashville Police Department to provide funding to eligible law enforcement agencies to develop and implement proven public safety strategies to combat violent crime and to develop, construct, or rehabilitate infrastructure. Item number 11, RS 2025-1643, sponsors Toombs and Huffman, a resolution accepting the terms of a cooperative purchasing master agreement with MBF Industries, Inc. for law enforcement vehicles that are manufactured for a special purpose and attachments for the Metropolitan Nashville Police Department. And lastly, on consent, item number 14, BL 2025-1117, and sponsors Coupon, an ordinance to provide for the designation of a public property within specified areas of downtown Nashville as a temporary special event zone during the time period beginning at 9:00 p.m. on Tuesday, December 30th, 2025, and ending at 6:00 a.m. on Thursday, January the 1st, 2026, relative to the use of these areas in conjunction with the 2025 New Year's Eve celebration and related activities and events. Do any of those items need to come off consent? I have a motion. Do I have a second? All those in favor, aye. Opposed, no. Consent agenda passes and we are at 8 votes. Thank you, Councilmember Weiner. Good to see you. Okay, we're going to go a little bit out of order, just trying to respect the time of Director Dietz. He's here on a particular item that I'm going to ask him some questions on. We're going to start today with item number 13, and then we'll go back to item number 1. Item number 13, RS 2025-1655, sponsors Stiles and Evans, resolution calling for the Mayor's Office and Department of Emergency Communications to enact various reforms relative to departmental leadership and workplace culture. Do I have a motion? Councilmember Evans, we'll begin with you.
Okay, thank you. I signed on so that way we could defer this for one meeting. And so I've got a motion to defer, please.
Any discussion? Yes, Councilmember Gadd.
Thank you so much, Chair. I do have just a question. I know the motion has been seconded, which is wonderful, but is there also, I believe there's an amendment filed by Council Member Benedict on this, and I didn't know if that's something we could look at adopting, or I'm happy to just look at that the next time if we're moving for a deferral.
Yes, there was a late filed amendment. Thank you for recognizing that. Yes. You're moving the late filed amendment?
No, I'll just wait for yeah. Thank you.
While we're on, so we do have a proper second on that deferral motion. While we're on this, I do want to go over to Director Dietz just to see if you could give us a current event update on where we are with this particular matter.
Thank you, Chair. On this resolution, I'm here to give 2 updates. One is that the Mayor's Office communicated with all members of the council this afternoon that he is denying the request to conduct an additional investigation into the director based on a lack of verifiable information. That said, there is a complaint that was made public in the media on November 5th. And that did result in the retention of an attorney, Luther Wright, to conduct an independent investigation. And so that gets to the second section of this resolution, where it asks that the Mayor's Office and Department of Law hire an outside independent investigator with no connection to prior reviews of the DEC. Well, before this was even filed, and before I had any knowledge that this was in the works even, on November 5th, when that complaint was in the media, the mayor consulted with me and I engaged Luther Wright that afternoon. And he is already doing his investigation. So the request in Section 2 to hire somebody other than Luther Wright, respectfully, I just simply cannot agree with that, because Luther Wright is already engaged and already conducting interviews in his investigation. So those are my updates.
Thank you, Director Dietz. Any questions at all from the committee for Director Dietz at this time? Councilmember Bitten, you're recognized.
Thank you, Director Dees, for being here. I was just curious, and I don't know how much you can openly and freely speak on this, but I know and I'm sure we have a policy and a procedure that we go through with complaints and concerns. And have we had official complaints yet? I know at one time we had not. And I know this was a media incident that may have triggered what we're looking at now. But even has that been an official complaint through HR or civil service?
Thank you. And if I may address, thank you, Chair. So up until the announcement by the employee, Ms. McGuire, that she stated that day on November 5th that she had filed a complaint with the HR representative inside the Department of Emergency Communications at DEC. Prior to that, neither the mayor nor I had knowledge of any complaint being filed. That is part of the investigation. So Luther Wright will investigate whether there was a formal complaint filed. Under the engagement terms, he is also going to report back on whether Metro responded appropriately to any complaint that was filed, yes or no. So that's part of the scope of his engagement. So Metro HR, large Metro HR has not seen a complaint. But what we don't know is whether one was filed with the local HR rep at DEC. And we will find that out when we receive Attorney Wright's report.
Councilmember Bitten, any other questions from you?
No, thank you.
Councilmember Weiner, you're recognized.
This too is for Director Dietz. Thank you again for being here. I'm just curious about the time frame for Luther's engagement.
Thank you. He's on the job right now. He's conducting some interviews this week. The scope of this is, it's not one of those things that will take months and months. We hope to have a report within 30 days. But once you get into an investigation, there are other things that can come up that can delay it. But based on what I know about the scope of the interviews and this, barring unforeseen developments, we should have this report within 30 days.
Thank you so much.
Thank you,
Chair.
Councilmember Weiner. Councilmember Gadd, you're recognized.
Thank you so much, Chair. I would like to ask a question of Mr. Dietz, if that's okay with you.
Sure.
Mr. Dietz, is if colleagues or any other folks have information that they'd like to share directly with the investigating attorney, is that something that is there a pathway for doing that?
Any employee who wants to reach out to Luther Wright should contact him directly.
Okay.
It's up to him
Okay.
to handle those requests. I am certain he would be glad to honor that request. And his email is on, if you Google Luther Wright, you find his law firm, Ogletree Deacons, and his email is right there, as is his phone number. So anyone who wishes to be heard as part of this investigation should contact him directly. They don't need to go through me or HR or anybody else.
Wonderful, thank you. I just want to make sure folks can hear that, and that's a pathway that we can ensure that exists, and to make sure we're sharing that. So thank you so much.
Thanks, Councilmember Gadd. Anyone else? Okay, so Councilmember Nash, you're recognized.
Thank you, Mr. Chairman. I know Director Hall is here, and I'm wondering if that contact information should be sent out to the employees so that nobody can say they weren't informed, didn't know that there was something they could cut. I can see this, being a never-ending cycle if we're not diligent in making sure that people understand that there's a place where they can go now, independent review. And I wonder if we might be able to maybe get Director Hall to send that out. He's here, if you don't mind asking.
Director Hall, I don't know if you want to comment on that.
Or she may not think it's wise, I don't know.
Yes, thank you, Councilmember Nash.
Hi, Councilmembers, Shannon Hall, HR Director. Just to clarify, I want to make sure I understand the request. Obviously, I have nothing to do with the investigation. That should be independently done by Luther Wright. So if anybody has any information related to the investigation, I think following Director Dietz' advice is the right advice to contact Luther Wright. However, if someone in metropolitan government, this is well documented in our employment rules, on our website, civil service rules, if someone feels as though they have been sexually harassed and wants to make a claim, they can come to their department HR coordinator. They can come to Metro Human Resources, our employee relations division, to file a complaint. They could go to Office of Civil Rights at the state of Tennessee, or they can go to the EEOC. Something that we had discussed with Women's Caucus 4 or 5 years ago are, for anybody who is a victim in this kind of situation, you don't want to limit the places where they can report, where they feel comfortable, but all of those parties, for the most part, should be able to help any employee. But what we've put on our website, and it is well documented for everybody, is if any Metro employee feels as though they have a sexual harassment complaint or discrimination complaint, they are always welcome to come to Metro Human Resources, Big HR. Our employee relations division is a really wonderful division. They are very objective and independent, and we can help them with that matter. But they do have other avenues that are available to them if they feel more comfortable with those avenues. So hopefully that helps to address the question.
No. Or maybe Mr. Wright can send out a letter if he knows where the different employees, and make it available if you don't want to bring in HR. I just think it's important that they be able to contact the special investigator for this specific special investigation, so that when it's over, we don't have 30 people jumping up and say, well, I never heard about it. Which happens.
I will speak with Mr. Wright this evening and get his suggestion about how best to accomplish that. It may come from the local HR representative on site in the department, and that would keep it in a more regular process than pulling in Director Hall or me in a communication. I will speak with Attorney Wright and get his suggestions about how to accomplish your objective.
Thank you.
Thank you both. Any other discussion? Councilmember Evans, you're recognized.
Thank you, Chair. So, yes, I still want to renew my motion to defer one meeting. And I think, the overarching theme, I think, of this conversation is frustration. And there's been a lot of employees who have emailed, and I understand that we may not have all the specific documentation or feedback in a direct way from those employees. But I'm encouraged that we are, proceeding with the allegation from the current employee that, took the time to speak about it publicly. And so I think it's important to have a conversation, regardless of whatever the lead sponsor elects to do from a framing perspective, if she decides to amend it, whatever. And so I appreciate everybody supporting the one meeting deferral.
Thank you, Councilmember Evans. So previously we had a motion to defer that was already seconded. So I'm going to go ahead and take the vote. All those in favor, aye. Opposed, no. Any not voting? Item passes 8-0. Thank you. All right. So, and thank you, Director Dietz, for being here today. All right. We're going to continue on with our agenda, a couple of cleanup items. So the first couple are going to be for the similar reason. Item number 1, RS 2025-1533, sponsors Toombs, Huffman, Benton, Coupon, and Vo. Resolution approving a Homeland Security Grant Program application from the Tennessee Emergency Management Agency to the Metropolitan Government, acting by and through the Office of Emergency Management to fund efforts to prevent, prepare for, protect against, and respond to acts of terrorism and other catastrophic events. So in budget last night, this item was deferred 2 meetings. So I would just need a motion for that. And thank you. Do I have a second on that? Any discussion? All those in favor, aye. Opposed, no. Any not voting? Item passes 8 in favor, 0 against. Item number 2, RS 2025-1534, resolution, sponsors Toombs, Huffman, Benton, Cupin, and Vo, a resolution approving an Urban Area Security Initiative, UASI, grant application from the Tennessee Emergency Management Agency to the Metropolitan Government acting by and through the Office of Emergency Management to fund costs related to enhancing security and the resilience of high-risk urban areas by building, sustaining, and improving capabilities to prevent, prepare for, protect against, and respond to acts of terrorism. Do I have a motion? And do I have a second? Any discussion? All those, so once again, so this is a deferral to defer. Okay, so all those in favor, aye. Opposed, no. Any not voting? Item deferred, 800. Moving along, and this is another cleanup item, item number 9, RS 2025-1637, sponsors Toombs, Huffman, Gadd, and Stiles, a resolution approving Amendment 1 to an Air Pollution Control Program support grant from the United States Environmental Protection Agency to the Metropolitan Government acting by and through the Metropolitan Board of Health for the ongoing collection of data on ambient air concentrations for fine particulate matter in Nashville, Tennessee. And I'm going to just ask Director Darby just for clarification on this one, because I believe this is the one we need some cleanup with a letter.
There is a substitute from Councilmember Allen that she has requested. It changes the caption to more accurately reflect the agreement and what the grant is being used for. This was the original resolution approving the grant was approved a few months ago, and the same amendment was put on. And when it came back with Amendment 1 to that grant, the captions contained the same inaccuracies. So this amendment just makes that change.
Thank you for that explanation. So I need someone to move the substitute. Yep. And do I have a second? Okay, all those in favor as substituted, please say aye. Yep. All those opposed, no. Any not voting? Item passes 8 in favor. Oh, I apologize. Yes. So now we have to move it as substituted. So do I have a thank you second? All those in favor, aye. Those opposed, no. Any not voting? Item passes. All right, and last item on the, next to last item, I apologize. Item number 12, RS 2025-1644, sponsors Toombs and Huffman, resolution approving an application for the statewide School Resource Officer SRO program grant from the Tennessee Department of Safety and Homeland Security for the placement of school resource officers in schools for continued efforts to establish and maintain safe and secure learning environments for eligible schools, K through 12, public schools, and public charter schools. Do I have a motion? And do I have a second? Any discussion on this item? All those in favor, aye. Opposed, no. Any not voting? Item passes 8 in favor. And, well, that's it for as far as the legislative agenda. I do have a couple of just quick updates. Number one, we did have a presentation from the Community Review Board planned. We are going to reschedule that for sometime in Q1, so be on the lookout for an announcement from me on that. I do want to also remind everybody that we, at the last meeting, started an interpersonal violence subgroup that we're very excited about. I know Councilmember Gadd, it's a very important issue to you as well. We are having a meeting on that. Just wanted to give a reminder that's going to take place on December the 9th at 2 p.m. in Committee Room 1. Definitely encourage you to attend that and learn more about what we're trying to do with this group. I do see a couple of departments here. Don't know if anyone wants a chance to give any updates. I see OHS back there. We can start with you guys.
Thank you.
Yes,
All right.
ma'am, you're recognized. Go ahead.
Hi, I'm Allison Cantway from the Office of Homeless Services. We have our monthly ARPA report going around. Thank you, Councilmember Gatt. Obviously, this contains a lot of data, which, you know, you're welcome to pore over. But we do have several important updates this month that we wanted to share. First of which is that we have been anxiously awaiting HUD to release their Notice of Funding Opportunity this year, NOFO as it's called. That's the mechanism by which we learn about how much funding is going to be available to our community for services around homelessness through the Continuum of Care program. It is typically released in July-ish. So we've been waiting and waiting, and it was released Thursday night. It contains major policy changes from years past. So I've outlined a few of them here, but I can certainly go into more detail of the things that we know so far. The policy changes are shifting away from permanent housing solutions into transitional housing. It has an emphasis on substance use treatment, participation requirements, and services that are time limited. So, and this is, I mean, that's a distillation of the many changes contained in the NOFO, which I think is 128 pages long. But luckily, the Performance Evaluation Committee, they determine sort of how these local projects are ranked to receive funding. Their scheduled meeting is tomorrow. So that's very good timing. They will be discussing the implications of this NOFO. HUD has given us significantly less time this year. And they have sort of, they've changed the guidelines such that we're especially time crunched. So we have a very abbreviated timeline that we're working with. We attended multiple trainings, have already attended multiple trainings already. HUD held a webinar on Friday that several of our staff members were present for. We attended a cohort today. We're attending another cohort tomorrow. So we'll continue to do that so that we can sort of be on top of everything. And we're setting up community planning sessions to prepare for these big changes. And I want to go through the rest of these, but I saw that there was a hand raised, so I don't know.
Councilmember Evans, I'll go ahead and recognize you. I do have a couple of questions to Ms. Cantway.
Sure.
Thank you, Chair. Thank you, Allison. So I guess I did download the NOFO and I've started to look at it, and kind of based on our conversations or the video I watched from Homelessness Planning Council, like we are massively out of alignment with this NOFO in comparison to kind of the strategy that we have been employing and kind of focusing on. And so I guess I understand, like, as far as the work groups and things like that, that you guys are going down this path. Like, what does that alignment shift look like? Several of us are going to National League of Cities. Salt Lake City, they've already made the shift. They're already building like their massive dorm for people who are not complying, you know, with their standards to then be able to shift to, you know, or face like the repercussions from that. So how are we looking at the bigger shift? And I think one of the things that I'm really interested in, and Health is not here to speak to it, I don't think. Actually, Kabir here, but you may not have a perspective, but you're welcome to weigh in if you have one, is Health has released an RFP specific for opioid settlement funding. And that settlement, like locally, we're taking a shift with that money where it's not really going to be used for things like treatment. I mean, that's not going to be, the emphasis is going to be more about education and kind of the front-loaded stuff to change people's behaviors before they start using, compared to dealing with the aftermath, you know, if they are using. So we're also kind of out of conflict or out of alignment nationally, and then I would say locally between the health shift, HPC, probably service providers and those kinds of things. And I know we spent a lot of money consulting wise to kind of last term, you know, with Mayor Cooper to kind of get us going in this direction. So anyway, I'll stop ruminating and let you weigh in. But I'm thinking of like, how do we get all of that figured out? Where does it flow through? Is HPC the ultimate? Or how are we kind of aligning that between the mayor's office, you know, this body, et cetera, et cetera?
Yeah. Great questions. as far as the policy shifts, like just to be clear, every COC in the country is going to be out of alignment because many of the things that are expressly prohibited in this NOFO have been requirements in the past. So for example, in the past, you've not been able to like condition receiving housing on receiving services or receiving treatment. We were not allowed to do that. Now we have to do that. There is concerning language in the NOFO that says that HUD reserves the right to make funding changes based on if any COC has complied with some of what were considered best practices, which puts every COC in a really tough position because they're saying that essentially they reserve the right to restrict funding based on complying with requirements from the past. So, we've got a lot of guidance coming in from national agencies, which is like, we're going to have to lean heavily on that because this is not going to be unique to Nashville for sure. I think that what is important to us is we want to make sure that we are maximizing as much funding as possible for Nashville while also providing really good services that are going to help people and are going to uphold our values and what we know to be best practices. So part of sort of threading that needle, and it's the second bullet point here on my highlight, I think gets to that. So this NOFO proposes cutting up to 70% of funding from any continuum of care. And it caps funding for permanent housing, which is permanent supportive housing and rapid rehousing. It caps that at 30% of a community's funding. But that additional 70%, they're really wanting to be pivoted towards transitional housing, street outreach, supportive services. I do think that there will be an opportunity for lots of local agencies to either, there are a lot of agencies that already provide street outreach, and that's not been eligible for COC funding in the past. So now it is, right? There are lots of programs that I think could maybe move themselves more toward a transitional housing model while also really providing robust services alongside that. Each individual agency, each individual applicant will kind of have to make their own calculation about what they are, what changes they're going to make. And then ultimately the way that it works here in Nashville, we have to have a rating and ranking system. That's a requirement by HUD. We're scored on that. We have an independent committee of the COC, the Performance Evaluation Committee, also known as the PEC. So it's made up of people who are really engaged on this topic, who understand a lot about HUD and continuum of care funding really in the weeds, but none of them are affiliated with any of the agencies that are receiving funding or that may apply for funding. So they're completely conflict free. They will make the decision as far as what are they going to prioritize at the top versus, moving down. And then ultimately, yes, the HPC is always the authority that votes to approve the rating and ranking. So the PEC will make a recommendation to the Homelessness Planning Council, and the Homelessness Planning Council will make changes or not make changes and ultimately approve it. And then that's what will be sent to HUD.
Councilmember Evans.
Thank you. And thank you for that very thorough explanation. And I think I guess thinking around because you touched on the value piece, what does Nashville value? What kind of city do we want to be? Those kinds of things. But then you also referenced kind of where some providers will have the opportunity to pivot or be eligible when they weren't eligible before. And then it's I think going to be really important for us to understand is we move into this season, what the delta looks like and where the shift is, because if we're losing opportunity for permanent supportive housing and gaining it in other areas, do we end up with a gap? Do we end up with where the city wants to support permanent housing, but we don't have that funding to do that as well or as frequently as we did before? What does that look like? And so that story I think will be really important for all of us to understand. And I also feel I think there's a very specific provider community, obviously, that's very engaged and hyper aware of all these changes. But there's going to be a lot of regular resident education on some of these things too, because there's going to be a lot of why kind of, I would say, directed to us of like, why aren't you doing X? And so just putting that adding that to your list of things to think about, that there's just going to be a lot of education, I think, of our body also outside of like the people that are in this committee or on the HPC or whatever. So just wanted to share that too. But thank you for that.
No, I think that's a really good point. And one of the like community cohort groups that we were on today, it had representatives from COCs all across the country. That was a big topic of discussion. How are COCs, how are collaborative applicants, how are agencies going to have these conversations with their clients to say that like we deserve, they deserve honesty of letting them know like this funding could significantly change, not in a way that's going to be alarmist, but in a way that's going to really prepare them. I think you're right that we're going to have to sort of track the delta on that. They indicated that HUD probably will not make announcements about the awards until like April or May. So we won't have that answer for at least a little while.
Thank you, Councilmember Evans, for the question. Mine is just more of an inquiry around cold weather operations, how that's going. If you could just give us an overview to where we're at. I know we're getting very, very close to permanent cold weather for at least a little bit.
Yeah, we are. So on this report highlight page, the very last update is about the cold weather shelter. So we hosted the first 2 nights of this season of the city's overflow emergency cold weather shelter last week. It was last Sunday and last Monday. In the off season, we've been able to make a lot of improvements to the building. There was a reflooring and there was painting done. Many of the residents remarked like, wow, this looks really nice, which was really, really, really good. I was glad that they felt very comfortable there. That first night we had 156 people. The second night we had 213. So I mean, pretty larger groups than sort of, frankly, what I expected on the first 2 nights. They went really well those first 2 nights. We have created some new partnerships with agencies to provide some services on site. So we have a partnership with Meharry, who had a medical staff member who was there the entire time that the cold weather shelter was open. And then we also have a partnership with the health department to have some clinicians on site as well. Obviously, they're not, like if it's an emergency, they're going to call 911 and send people in an ambulance. But for people who, maybe need some guidance or have questions, or is this an emergency? How should I follow up? It was we can tell just from the first 2 nights, that service is going to be completely invaluable to our people. So I feel like the first 2 nights, we didn't have any major incidents. But you're right. Any night that we're below 32, the cold weather shelter is going to be open. And in the beginning, it'll probably be a night here, 2 nights there. And then at some point, we will probably get to most nights in a week. We monitor the weather extremely closely in our office.
Thank you very much. And last question for me, just in regards to overall experience when I'm there and I'm at the shelter. Just for the record, just what's offered as far as like a blanket, pillow, things like that. What's offered to folks?
Yeah. Well, first of all, when folks come in, we serve hot dinner every night. We serve hot breakfast every morning, right? So that's available to everyone. We also give out snack packs when folks are leaving so that they have some food to take with them. We provide, so let's see, we have cots with a raised head on them. We provide clean every night, a sheet to put over your cot, a clean blanket for you to use. And we have those sheets and blankets in abundance. So sometimes somebody will say like, I'm feeling really cold. Can I have a couple blankets? Or like, I want a blanket to prop my feet up on, or I want a blanket to put under my head. And that's like, we are always able to accommodate that. And then we also have, based on like generous donations that we've got, we are able to give out things like clothing, things like, hygiene items, soap, toothbrushes, most everything that someone would need to stay in a shelter overnight. And if we don't have it, we make plans to get it. And so as long as those things, continue to stay in stock, we will continue to give them out.
Thank you, Allison. I appreciate that very much. And just a note on that, so last year I was a part of an effort that was able to deliver some pillows. I'd love to do that again. It's just the humane thing to do in regards to somebody laying their head down at night. They deserve to be comfortable. And I've got a coat drive going in my neck of the woods that hopefully we'll be able to get some good stuff for and headed y'all's way. But appreciate y'all's efforts. You got a lot of work coming ahead of you. So thank you.
Thank you.
Anyone else? Oh, I'm sorry. Yes, Councilmember Gadd.
Yeah, thank you so much. And thank you so much for the report and for this to make sure we know what to be on the lookout for. Just two things here. I appreciate my colleague asking the questions on to get a little bit more in details as you all are learning to understand what the changes are going to be. And just since it appears that we could have over 800 people of 400 households that are going to be displaced due to federal funding loss. Can you be sure to continue to keep the chair so we can have an emergency meeting or whatever that may be as we continue to learn of how we're going to be responding? Perhaps that won't, it seems inevitable that something like that's going to happen. I appreciate you all informing us and you making sure that we're looking at that. And thank you to the chair for making sure we're always prioritizing our in-house community. I think, so with that, just wanted to kind of echo colleagues' concerns there, but thank you for sharing that. And I look forward to hearing more as soon as you learn more. And then the other thing, just if you could remind me the number of those temporary beds that we have for cold weather.
The number of beds at the cold weather shelter? Oh, I don't know the total number.
How many?
Yeah, we've gotten up to 400 before.
Okay.
So we at least have that many. We may even have more than that.
400 or more?
Yeah.
Okay, thank you so much.
And I think we will keep everyone updated. Of course, we're here once a month. We have the Homelessness Planning Council, which is a public meeting once a month. And then we have continuum of care meetings. There are like 14 of them a month. But obviously, if any of y'all have any questions, you can always reach out to us. Yeah, this was a really rough estimate of it could be up to this many households or individuals losing their housing. That would be like the worst case scenario. We hope that that's not what comes to pass, but I think we have to be prepared.
Thank you, Allison. Appreciate your questions there. Anybody else have any questions at all for Allison? All right, I think you're free. Thank you. Anybody else have any departmental updates? Pastor Tucker, I saw you come in. Anything from you, sir?
Thank you, Chair. Just a reminder of our second annual Friendsgiving this Thursday from 6 to 8 at the Farmers Market. There's still space. If you would please register. Our theme this year is a courageous welcome. And we're looking to have a great time. So we invite you to come out and be a part of it. Thank you.
Thank you, sir. Anybody else? All right, we're adjourned.